Let's get more now with NBC News medical contributor Dr. Kavita Patel. She's a practicing physician, also served as a policy director in the Obama administration. Dr. Patel, it's always great to get your take on everything, basically, medical and pharma. And I'm wondering what your first reaction is and how you think this could impact what the FDA does, what the CDC does, what the NIH does, what the CMS. I mean, the reach is vast here.
It is, Melissa, and I would not be honest if I didn't tell you I'm stunned. I'm still a little stunned. I think there's a number of us who have been in Washington, D.C. around many administration transitions. This is the most unusual one I've seen to date. And I think to your point, if you're Pfizer, BioNTech, Moderna, GlaxoSmithKline, where the bulk of your revenue comes from vaccines, this is a big problem because, as RFK Jr. has said, he's said time and time again, Melissa, he's not anti-vax. He's just against the vaccines that we have currently available. So in effect, any of the vaccines that we've talked about, from COVID to the vaccines that we give routinely for children, he's been able to stoke fears and put out a lot of misinformation, frankly. And on top of that, even when he ran for president, he made a comment, and it's been recorded, that he said that he would stop drug development and research for 8 years if he were elected president. That has sweeping impacts to institutions like the NIH, the CDC. And then let's not forget, the secretary does have quite a bit of authority over declaring public health emergencies. You could imagine declaring an emergency around vaccine safety, but not in the direction that we have. And I've been looking at the state of Florida just to see what's possible, where you had a surgeon general there that recommended that if you had measles, you could choose to send your children to school with active infections. That could be a little bit of a preview of what we see on a national level.
Robert F. Kennedy Jr. has also said that he wants doctors who are not beholden to the industry. He views many doctors as having conflicts with either pharmaceutical industry or other parts of the food industrial complex. What implication do you think does that have on drug approval, particularly at the FDA?
Yeah, it's very complicated because it could have far-reaching implications just for the staff, right? There already are conflict kind of regulations to make sure that people working on certain drugs or classes of drugs do not have any material conflicts. But you could imagine that they could extend what that interpretation is way beyond what's intended and say a doctor like me who has actually prescribed medication could be deemed a conflict, and I could never be on an advisory committee. I might not be allowed to actually be part of an agency to be a part of informing that process. So you end up unintentionally, Melissa, taking away the very experts who have expertise in a particular area. And let's talk about cell and gene therapy. We've talked about this. You've discussed this on this very show, how important this next decade is for cell and gene therapy. That's a very small pool of people who have that kind of expertise. Imagine saying that anyone who's even touched a trial funded by a drug company is not allowed to be part of a process where they give advice or even advise regulatory authorities. We're going to really undermine what I would say has been an incredible opportunity for research and development and getting cures to patients. I've never seen anything like what's possible now with sickle cell, cystic fibrosis, retinoblastoma. And Melissa, you could be undermining decades of that progress.
Dr. Peets, Tim, great having you on this night, because when I hear about someone that controls Medicare and Medicaid, and I also think about what we talk about all the time in terms of the deficit in the budget and dynamics and we now have a new position that's there to cut down government fat. Right. And while we've added, by the way, a new department and a new agency. But it seems to me that there's some obvious places to go after. And can you help us with a big picture look also on what the ability could be in terms of attacking the budget and the spending that goes towards Medicare and Medicaid?
Yeah, I think we can see a little bit of like a reprise of what we saw at the beginning of the first Trump administration, where you saw kind of a gutting of that role for navigators, people to help you navigate not only Medicare benefits, but also just the insurance. Remember, CMS, Centers for Medicare and Medicaid Services, also oversees the marketplaces. Those are exchanges. Those are companies like Oscar Health. Actually, every major insurance company offers plans on the individual market. That's for people who don't get employer-based insurance. Think Uber workers. Think people who just don't have access to that. So these are millions of Americans. You could gut the ability to navigate those services and even staff those services. You see enrollment come down. In terms of Medicare and Medicaid, there's a lot of questions about who's going to be pushing for the subsidies that we use to keep funding some of the Medicaid programs around the country. Will there be a push from a Trump White House and a Trump HHS to get those subsidies when they are expired? it's going to be hard to imagine that this is an HHS or White House that will put focus on that. So the private sector really is affected by any of these changes. You like to think that the government is kind of on an island and that you can create efficiencies. It will affect every aspect, including my own healthcare, which I get through my employer, because those very employer-based insurance plans are the same plans that are trying to offer subsidized insurance on the Medicaid market. Medicaid being one of the largest payers is no trivial thing. So the other piece that's concerning is that you just need to have, we just talked about all the new innovations that are coming, cell, gene therapy. If you block or put a halt to that access, what happens when you're trying to think about paying for those therapies? And what do hospitals do? Hospitals have an obligation to treat patients. This then becomes debt that they cannot recoup simply because there's a lack of a payment model. So it's, as they say, it's complicated. And we're all going to be watching to see what kind of nominees come under an HHS secretary like RFK Jr.